Thank you. Well, thank you everyone for attending today. So in regards to the booklets, I did have about 20 of them. So some of you I see have them, others you have to use the PowerPoint packet. The reason being we have not reprinted these since the administration change. I had a remnant of them in my trunk, so I brought those in. I wasn't sure how many folks were gonna show up. So if you have the printed out PowerPoint, it's obviously going to just follow the slides. So you just follow along. You might have a slide or two that looks a little bit different because that was left over from a coworker who had a presentation. He printed like 100 of them and had tons left over, so to save paper, I just took those instead of reprinting. So a couple of my slides might look a little different than what you may have in the packet, but it's all there. The biggest thing is that you have our phone number. So that is in the packet and it is in the book. If you did grab the book, I will let you know what this PowerPoint slides correspond to what pages in the book. Because there is more information in the book and the slides don't hit on every single page. They're more of a summary. If you really want this book, I would say give our office a call in a few weeks and hopefully we'll have a stack or have State Printing have printed some more that we could mail to you, because we mail these to folks all across the state if you really want the book. But having our phone number is your greatest asset because you can call us with questions. So I do work for the Ohio Department of Insurance, and within the Department of Insurance is our program called OSHIP with the P at the end. Not OSHA, OSHIP. So that does stand for Ohio Senior Health Insurance Information Program. We've been around since 1992. We are federally funded by a grant from Congress to go all over the state of Ohio to provide outreach and education on the Medicare program. So the big takeaway from that is that I'm not an insurance agent, and we don't sell insurance. We don't rate, recommend, or endorse. We are strictly objective. We are strictly educational. We are unbiased. We're just here to give you the facts so that you're making educated decisions about your Medicare choices. Another part of our program, and I might be skipping ahead, so I do believe we have a slide kind of talking about this. In your book, it would just be on page 2 if you're opening up your book. So as I stated, we are federally funded, and that is our phone number. It's in the book, it's in your packet, but a huge part of our program is recruiting and training volunteers. So statewide in all 88 counties, we have local volunteers who are trained by the 5 liaisons like myself to be able to serve as a local Medicare resource in your county. So for Lake County, for those that live in Lake County, your biggest asset is the Council on Aging, the Lake County Council on Aging. I'm going there right after this to visit my coordinator there. Are there any other counties represented? Yes. Okay, so in Cuyahoga County, we have a lot of volunteers. We have over 50 of them. They're scattered all throughout the county. So instead of me listing 50 different sites, I would tell you the best way is to call our phone number. Let us know the city that you reside in, and we can locate you to the closest site where you can actually meet with a volunteer face-to-face. But you might actually get a lot of your questions answered over the phone. We have a helpline staffed with maybe 10 or so people. I know them all by name. We are not a huge call center. So we can answer a lot of your questions over the phone. We have caseworkers who are dedicated to doing more of the nitty-gritty casework. So I can't stress our number enough. A lot of people don't know that we exist, so now you do. And we encourage you to call us because Medicare is confusing. There's a lot of pieces to it. You get a lot of misinformation. So we want to be that source for accurate information. So we always tell people, start with us. Give OSHIP a call and let us kind of walk you through your situation. So the next slide here is also on page 2 in the booklet. It's just highlighting that folks are getting new Medicare cards. Ohio started getting their cards back in October, but technically the government has all the way until April of this year to finish giving out those new cards. So for some of you, you don't even have a card yet. But for maybe a family member of yours, they are getting a new card. It's redesigned. It's still red, white, and blue, and it's still paper. A lot of people ask if they're going to get a plastic card. Nope, you're still getting a paper card. The biggest change on the card is that they have removed Social Security numbers. That's to help with identity theft and fraud and things like that. And everyone's just getting reassigned a random 11-digit number. So that's what that card is highlighting. Now on page 3 in the booklet, and obviously if you have the packet, you're just going to follow along. This is really the nuts and bolts of Medicare, this visual that you see. So it's saying, what is Medicare? Obviously that is health insurance. It's coming from the federal government and it is administered by the Centers for Medicare and Medicaid Services, CMS. So Medicare is confusing, it is a puzzle, and like I stated, there are a lot of pieces to it, but it is as simple as saying you have two choices. That's your million-dollar question. When you retire and you're needing insurance and you're getting on Medicare, you have two choices. You either go with original Medicare, which is option 1 that you see, or, and that's a big or, you do what's called an Advantage plan, and that's option 2. This entire presentation is meant to break that down for you, to explain the 3 different parts of option 1, because as you see, you have original Medicare, and then you have some type of secondary insurance, usually, and then that third requirement is your drug plan. We call that Part D. I'm going to break down all those 3 parts, how they work together, and I'm going to do that first, so takes a little longer to get through that, but then at the end I will explain Advantage plans and how they're different than having traditional Medicare, and how they work and operate. And that's considered option 2. So Medicare is meant for folks who are 65. That's the magic age for Medicare. However, the earliest age someone can start collecting their Social Security retirement is age 62. Did you know that? Yes. Okay. So a lot of people assume, well, if I start collecting Social Security at 62, then I can get Medicare. But that's not the case. The age for Medicare is 65. And anyone who is a legal U.S. resident, 65 or older, is eligible to sign up for Medicare. And I will get into what does Medicare cost. However, some folks do get Medicare early if they're disabled. So sometimes I do counsel folks who can be much younger than 65 and they do have that red, white, and blue card because they've been collecting Social Security disability insurance for 2 years. After 2 years of collecting that, they're automatically put on Medicare. Also, at any age, if someone is diagnosed with end-stage renal disease, where that's permanent kidney failure, they can get on Medicare regardless of their age. But I'm willing to bet most of you in the room are probably getting closer to that age 65 and you're wanting to know about your benefits. So let's start with option 1. What does it mean to just have traditional Medicare? If you flip to page 4 in the booklet, that's going to talk about applying. Does anyone know the government agency you go to sign up for Medicare? Just shout it out. Social Security, you are correct. Another reason why people confuse their retirement benefits with their health insurance. So Social Security is the gatekeeper into Medicare. Their only role is to just sign you up. They will mail you your card and they will make sure you keep paying your premium to the government. That is it. They can't counsel you on Part D plans or what's a supplement versus what's an Advantage plan. That's where the ships come in. We're the ones to do that education. So you do in fact go to Social Security to sign up and you have 7 months to do it. That's called your IEP, your initial enrollment period. So naturally that is going to center around your 65th birthday. Really it's the month of your birthday because Medicare benefits always start the first of a month. So even if your actual birth date is the 17th or the 5th, your Medicare is always going to start on the 1st. So it all centers around that birth month. You can sign up for Medicare as early as 3 months before your birthday. You can go the month of your birthday, and then you can go as late as 3 months after your birthday. However, we would encourage you the sooner the better. We wouldn't encourage you just to sit and wait to the very last second to sign up for your Medicare insurance. We encourage those 3 months before. Just one of those 3 months before your birthday. That way, you can be assured that your benefits actually start day 1 of your birth month. If you go and sign up the month of your birthday, you have to wait until the next month. And if you sign up one of those 3 months after, it keeps pushing back your start date, and you may have to wait 2 or 3 months for your insurance to be effective. We don't want people to have a gap where they're waiting, so that's why we encourage the sooner the better. If you have the booklet at the bottom of page 4, it does highlight an enrollment example. It shows you, depending on what month in that 7-month period you actually enroll, when your benefits start. So just remember, the sooner the better. Try to do it before your birthday. Now that top bullet point is highlighting that for some people, they're automatically put on Medicare, meaning your card just shows up in the mail. So usually it is a surprise to people. That is only for people who decide prior to 65 you're going to start collecting Social Security. So we identified their earliest age as 62. So if you start collecting at 62, 63, or 64, you will fall into that group of folks who will automatically be put on Medicare. Social Security just signs you up and mails you the card. But that's not everyone. In fact, a lot of people are choosing to wait to collect their Social Security. They want to wait until maybe 66 or 67, or you might keep working into your 70s, who knows? So that would bring me down to the bottom bullet point. Now, if you are still currently working, or you have a spouse who is currently working, you can actually delay Medicare. Because if you're currently working and the employer is giving health insurance, that is your insurance. It is your primary insurance. And it really isn't worth it in most cases for you to be paying a premium to have Medicare when it's not really going to pay anything, because your employer insurance is your insurance. So you may not be currently working, but you might have a younger spouse or an older spouse who's still working. So whether it's you or the spouse, as long as somebody's working and getting insurance from an employer, you can delay Part B. Now, the reason we specifically highlight Part B is because that is what you owe a premium on. Most folks do not pay a monthly premium to have Part A, and I'm going to talk about those too. So sometimes people will just sign up for Part A, but they'll decline B. Why would you sign up for A though if it's not doing anything for you? The simplest answer is because it's your entitlement. It gets you in the system, it's your entitlement, you've been paying taxes into it all your life. So a lot of people at 65 will take Part A, delay the Part B if someone is still working. You could delay both. You could just do absolutely nothing, and that's fine too. You don't want to take Part A though if you are contributing to a health savings account. Would that be anyone in the room? Okay, so there is an IRS rule that says you cannot have Part A and actively contribute pre-tax dollars into a health savings account. So if that's you, you don't want to do anything at 65. Don't take Part A, don't take Part B, don't do anything. If you're going to keep working and you want to keep contributing money out of your paycheck into that health savings account, I would encourage you to come up to me after the presentation. But other than that, most times we'll say take Part A, delay the Part B. In the booklet, that is highlighted right there in that little box, if you have the booklet. But the moral is you want to go to Social Security to apply for Medicare. And you have 7 months technically, but we encourage the sooner the better. So on page 5 in the booklet, it is going to highlight Part A, and then when I talk about Part B, those of you with the booklet, you'll want to flip to page 6. But Part A is your hospital insurance. So that's that FICA or that Medicare tax that's coming out of your paycheck. It's funding Part A. So it is the hospital coverage. More specifically, it's your inpatient. You really want to think of Part A as your inpatient coverage, because you might be at the hospital, but that doesn't mean you're inpatient. So Part A is only covering a hospital stay if you're actually admitted as an inpatient. You can also be an inpatient at a skilled nursing facility, and people will usually go into a skilled nursing facility short term to get some kind of rehab or therapy, like physical therapy, speech therapy, occupational therapy. Medicare does cover that. It covers short-term stays at a nursing facility. The key word, short-term. It does not pay for long-term care. It does not pay for people to permanently reside in a nursing facility, because that transitions into personal care, custodial care, long-term care, and Medicare does not pay for that. It just pays for the short stays. But there is a prerequisite to that, so this is pretty big. You want to remember this. You want to highlight it, you want to write it down. Because in order for Medicare to even approve your short-term skilled care, such as PT, OT, speech therapy, you must have a qualifying hospital stay first. And that is 3 full midnights that have to go by where you are inpatient. So that is why when you are at the hospital, you want to be aware of what your status is. You don't ever want to assume that you're inpatient just because you stayed the night. You always want to ask, what's my status? Am I inpatient? Am I outpatient? Because you have to be 3 days inpatient for Medicare to approve and cover any type of subsequent skilled care you might need after your hospital stay. And sometimes hospitals do keep folks under observation. Have you heard that term? So that's why you want to know, are you under observation or are you actually admitted? Because that law hasn't changed since it was written in 1965. So that's how the coverage for skilled nursing works. And then Part A would also give some home health coverage and hospice coverage if someone needed that. Now, if you flip to page 6, for those of you with the booklet, it is going to highlight Part B, which is your medical care. And Part B is what everyone in this country that has Medicare is paying a premium for every month. We have the next slides that's going to talk about that. But think of Part B as your outpatient coverage. So Part A is inpatient, Part B is outpatient. The majority of the services that we have are usually outpatient. It's all your visits to your doctor, it's all your visits to see specialists, any type of blood work and testing or imaging like an MRI or an X-ray or an EKG, all of that's falling under outpatient services. Therefore, it's covered by Part B. Part B also covers durable medical equipment, so we call that DME. That's a really long list of different items, but common examples would be walkers, canes, wheelchairs, oxygen, CPAP machines, your diabetic testing supplies, any type of medical item would be covered by Part B too. And then also some preventative care, which we will touch on. The bullet points at the bottom are highlighting some things that we want the public to know. First is that Medicare was never intended to pay 100% of everything. So there is cost share. You do owe an out-of-pocket. And I promise we will get to that. We will talk about your out-of-pockets. Also, Medicare only covers what is medically necessary. That is the buzzword. There has to be a medical necessity for why you need that service. So there is at the bottom of page 6, for those of you with the booklet, for those of you without the booklet, you can jot this down. There are statutory things that Medicare doesn't pay for ever, period, because it is not written in the law. Such things as vision, dental, hearing, long-term care, which I did mention, some other maybe obvious things like cosmetic surgery, any type of alternative medicine like acupuncture, or some folks that I speak with are really into using oils and herbs and alternative forms of medicine. That's not covered, things like that. But the big ones we hear about are vision, dental, hearing. So Medicare is not paying for routine vision, meaning it doesn't pay for your routine eye exam to get a prescription for your glasses or your contact lenses. It doesn't cover routine dental, like teeth cleanings or extractions or fillings or dentures or things like that. And it doesn't pay for hearing aids and hearing exams and things like that. So it's just not written to law, so it doesn't cover that. Also, Medicare doesn't cover any care outside of the US. So if you are a traveler, if you do go outside the country, or even if you do go on cruises, technically on a cruise ship, you are outside of the country, and most likely that cruise ship is probably European. So you are outside of the country. Therefore, Medicare, it doesn't cover any type of health service you receive outside of the US. So it's a US program. It only pays for the health care that you're receiving in the US. And I do talk to quite a few people who travel. So you usually would purchase like temporary traveler's coverage. I know when my husband and I went to Jamaica on our honeymoon, we got temporary traveler's coverage. When you go on cruises, they offer that as a package you can buy. That's for that reason. Now the next page is page 7, and the next slide's talking about preventative benefits. We like to educate on this because they're underutilized, and Medicare didn't always give preventative care, but there is a push in the healthcare industry to prevent illness, to prevent disease. So a couple things I'm going to highlight, not going to go through all of those. You might be wondering, why are some red? Why are some not red? The reason is most of your preventative care is no cost to you. So there's no out-of-pocket. Your normal copay or your normal 20% coinsurance is waived for most of these, except the ones I have in red. So that's why I highlighted that for you. For example, with the colon cancer screenings, Medicare covers 5 different colon cancer screening tests. 4 of them would be no cost to you. But if you elected to do the 5th one, you would pay 20% on that. Now, Medicare does give glaucoma screenings because that is considered a medical necessity. It's a disease of the eye, so Medicare does cover that type of vision, just like it would also pay for cataract surgery. So glaucoma screenings and cataract surgery, it would cover. It just doesn't cover the routine vision care. So with glaucoma screenings, you do owe a 20% coinsurance. Prostate cancer screenings, the PSA antigen test is free. There's another type of exam that a gentleman could have done. You would owe a 20% on that. But all of these are spelled out in more detail in a big benefit book that you will get mailed to you when you have Medicare. So every year the government will mail to you a booklet called Medicare and You. It spells out all the details of Part A and Part B. So in that booklet, you will see little paragraphs about all these different screenings, how often you can have them, things like that. 2 other things I want to highlight. When you do first get on Medicare, you get a one-time physical. It's a pretty in-depth head-to-toe physical. We call it the Welcome to Medicare physical exam. But the key thing to remember is that it's only one time. So Medicare does not give annual physicals. It gives a one-time physical, and that's when you first get on Part B. So you might get Part B right at 65 when you were eligible, but maybe you worked 5 more years. And now you're 70 and you're retiring, and now you're getting Part B. It's just whenever you get Part B, please know that you have 1 year to schedule that physical. And if you don't use it, you lose it. So we encourage people to utilize that one-time free physical, because every year after that, you get what's called a wellness exam. It's not a physical, it's more or less a face-to-face visit or office visit with your provider. They do a health risk assessment, they ask you questions, they touch base with you. It's just not that in-depth physical you might have been used to the years that you worked, things like that. Now we're going to go to page 8, and the next slide here is highlighting this year's Medicare amounts. Now, those with the booklet, you do have 2018 amounts, because we have not printed yet this year. This is carrying over from last year. So feel free just to write them in. But these amounts change every year. You don't have to memorize them. It's more just understanding the concepts of them, and that's what I'm going to go through. So let's start with Part A. I did mention earlier that most people do not pay a premium for Part A because most of us or our spouse has worked at least 10 years. As long as you've worked at least 10 years and you paid that Medicare tax, you get premium-free Part A. So they call that having 40 quarters or credits of work history. And as I mentioned, if a spouse stayed home and the other one worked, then the one that stayed home can go off the spouse's record. So because of that, most people are not paying a premium for Part A. But one of the biggest out-of-pockets with Part A is something called the hospital deductible. So this year it's $1,364. The unique thing about this deductible is that it's not annual. It's not a one-time thing. It's every time you have a benefit period. Everything with Part A is structured around benefit periods. So they're a little confusing to explain, but essentially a benefit period starts when you are at the hospital and you get admitted. Once you become an inpatient, you've opened up a benefit period, therefore you will owe the deductible of $1,364. That's what you owe. You will stay in that benefit period for however long you're inpatient. So you might just be inpatient for a few days, you might be inpatient for a week, you could be inpatient for 2 weeks, it depends on what's going on with your health. But when you are in that benefit period, Medicare is keeping track of all your inpatient days. So they keep tally. How long are you inpatient within the same benefit period? That's where you see underneath it starts showing copays. Because if you do stay in the same benefit period for quite some time, after 60 days, days 61 to 90, you start owing $341 per day. That would be in addition to the deductible you had to meet in the beginning. That's a little more rare that a hospital keeps you that long as an inpatient. Most likely they would move you to a nursing facility, but it could happen. Now, if you go past 3 months of being inpatient in a same benefit period, it pretty much doubles, and then you would owe $682 per day for days 91 to 150. Again, that's more rare that people actually are hitting those limits. Generally, people are inpatient for a few days. So the benefit period starts when you're admitted. It ends once you've been discharged and out of the hospital for 60 days. So that's about 2 months. After being out of the hospital for 2 months, your benefit period's done. What that's telling you is moving forward, if you're ever hospitalized again for any reason, you would be starting a whole new benefit period. Therefore, you would owe the $1,364 again. So it's really just based on the timing of when you're in and out of the hospital, and that's how Part A works. Who remembers the prerequisite for skilled nursing? What must you have first for Medicare to cover those short-term skilled stays? Yes, 3 days inpatient first. It's very cut and dry. You either meet it or you don't. So hospitals are pretty aware of how Medicare works. It's been around since 1965. They're usually working with you to get that coverage, but it still would be good for you to know how it works and to advocate that you are inpatient and that you stay long enough if you're going to be discharged with 2 weeks of physical therapy, things like that. So you have to have that 3-day inpatient stay first. The first 20 days of your skilled care, you don't owe anything. But if after 20 days you need some continued, let's say, physical therapy, then days 21 to 100, you would owe $170.50 per day. And so you get 100 days of skilled care per benefit period, not per year, per benefit period, because it all resets once you start a whole new benefit period. Now with Part B here on the right, I have been touching on the fact that everyone owes a Part B premium. So once you start collecting your Social Security retirement every month, your Part B premium is going to automatically come out of that check. You have no choice. It just comes right out. But what happens if you retire at 65, but you wait to collect Social Security until 68 because you want a higher check? Well, then the government doesn't have any check to take that money out of. So what they do is they bill you. They bill you quarterly. So every 3 months, you would get a bill that you would pay like any other bill. Write a check, send it back kind of deal. But it would be in a 3-month increments. And not everybody wants to pay in like 3-month chunks. But that's how they would bill you. But once you start collecting Social Security, they take it out of that check. And this year, the Part B premium is $135.50 for most people. It may be income-based, meaning folks with higher incomes pay extra for Part B. That is spelled out at the bottom of page 8 for those of you that do have the booklet. In essence, if you're a single individual making more than $85,000 a year, you pay more for Part B. If you're a married couple making more than $170,000 a year, you pay more for Part B. So there is, I would say, about 3 or 4% of the population owing what's called the IRMA. That's what they call it, the Income-Related Monthly Adjustment Amount, IRMA. The folks that have to pay extra for Part B because they have a higher income. Also, if you sign up late for Part B, there is a penalty for late enrollment. It's 10% for every full year you should have had Part B, but you didn't sign up. What is the only exception to that where you can delay without penalty? If you're still working, correct. Remember I said in the beginning, if you're working or you have a spouse who's working, if you're covered by employer insurance, you can delay. But other than that, folks do need to take Medicare when they're first eligible to avoid that penalty. And believe it or not, I run into a lot of people who did not do that. For various reasons, they just didn't sign up, and then they get hit with that penalty, and it's stuck with them their whole life. You don't get out of it. So every month you pay an extra amount because of a penalty. So we don't want people getting penalties. That's why we encourage people to take Part B when they are first eligible, unless obviously they're still working. Part B also has a deductible. It's a one-time deductible. It's $185. So you pay the first $185 for anything that's outpatient. The first time you go to your doctor, the first time you have an x-ray taken, the first time you have blood work taken, anything like that, you're paying the first $185, and then Medicare will start paying 80%. And then you would get a bill for 20%. So you will always pay 20% of the approved amount, meaning Medicare works off a fee schedule. So for every service code that could come in, Medicare says this is what we reimburse, and that's what providers get. So you always pay 20% of that amount. The provider could bill $500, but Medicare might come back and say, we reimburse $100. Therefore, you would owe $20 of that. Does that make sense? It's that 80-20 share. Now we're going to move on to something real quick. It's page 9 for those with the booklet. Just want to highlight that there are some savings programs for folks who might be living on a limited income. That may not be you, but it might be someone you know. So we do educate the public that there are things such as QMB, SLMB, QI. Those are programs meant to help people living on a limited income to have that Part B premium paid. So that would give them an extra about $135 in their Social Security check every month to live on. So if that's someone that you know, we encourage you to have them call us. We can screen them in more detail for eligibility. Now the next page, and for those with the booklet, I want you to go to pages 10 and 11 for right now. I'll eventually have you flip to page 12. Those of you with the packet, you're just following right along. So now I'm going to move into secondary insurance, because generally speaking, people don't just keep the red, white, and blue card as their only insurance. You can, but you don't have to. Most people who decide they want to go the original Medicare route, they will also pair it with what's called a Medigap plan. You ever heard of that? No. A Medigap policy, a supplement policy, MedSup, those are all terms for the same thing. I'm going to talk into more detail about supplements, but before that, I do want to highlight that not everybody needs to run out and buy a supplement because they are expensive. And I will touch on that. For example, at the bottom bullet point here, you see Medicaid. Have you ever heard of Medicaid? Yes. Sounds a lot like Medicare, so people can sometimes confuse the two programs. But there are folks that we call dual eligible who have both. So they have Medicare from the federal government and they have Medicaid from the state of Ohio. So it is needs-based. It's for folks who are living on a limited income, but there are folks who have both. Medicare pays first, Medicaid pays what's left over. So we call that being dual eligible. But naturally, not everyone's going to be eligible for Medicaid. Some people also have what's known as group health insurance from your former employer, meaning you retired from a union or state retirement system such as state teachers, or school employees retirement system, or public employees retirement system, or police and fire, or FERS. You retired from the federal government, like folks who worked for NASA or the post office. Those are examples of retirement systems that do give insurance to their retirees. There are still private companies that do give insurance to retirees. If that's you, someone you know, you don't need to go buy a supplement because the plan that they're giving you is going to coordinate with Medicare. So really what they generally just require you to do is sign up for A and B Medicare and you're done. And then they give you a plan that they have selected. But that's not everybody either. And more we're seeing those types of benefits being canceled because companies and systems can't afford them anymore. So that is why about 70% of the national population says, I'm going to do Medicare with a supplement, okay? So for those of you with the booklet, I would encourage you to go to page 12 because I'm going to talk about these plans. Remember, those of you that don't have a booklet, if you call us, we will mail you one. Okay? But when it comes to supplements, some key things you want to know is that the plans are standardized, meaning a lot of insurance companies sell supplement plans. And you do have to go to the carrier or the company to get a supplement. So you're probably going to have to call an insurance company and talk to someone over the phone or go to an agent or an insurance broker to sign up for supplements. We, as OSHIP, cannot put you in a supplement. We can educate you on them, we can explain how they're different, but we can't sign you up for one. That's going to involve some homework on your end to actually go to an insurance agent or broker and have them talk to you about the companies that they're selling for and the plans that they're selling. But things you want to know is that the plans are standardized. So all companies are selling identical plans. We want you to shop around to 3 to 5 different companies to get 3 or 5 different quotes because they're all going to charge you something different for the exact same product. So you got to shop around. You got to be a smart shopper. So with supplements, you essentially have 10 different plans you can go with. They are identified by a letter. That's what the chart on page 12 is breaking down to you. How are they different? In Ohio right now, the most popular ones are Plan F as in Frank, Plan G as in girl, and Plan N as in Nancy. Right now we are saying that Plan F is like the Cadillac of the 10 options because it pays for everything. So if I go back to this slide, you guys remember all these amounts that I went through? A Plan F supplement pays all of that, minus your Part B premium. You will always pay that. But they'll pay all your deductibles, all your co-insurance, all your co-pays, everything. So what do you think that means about its price? It's the most expensive of them as well. So I would say for a 65-year-old wanting a Plan F, you're probably looking at around $150 a month. So you're paying $135 for Part B, and then $150 would be another premium that you would owe to have that Plan F, but then you're not really paying any doctor bills. You're going to the hospital, you're going to the doctor, you're having services done, and your Plan F's picking up all of it. So that is why people will go into it because they don't want to have to worry about those doctor bills. But I also told you that Plan G is very popular. The only difference between an F and a G is that Plan G does not pay the Part B deductible, which is that one-time $185. So people will go with a Plan G because they will get a cheaper monthly premium, and the only out-of-pocket they owe other than the premium would be that one-time $185. But if you can save 20 to 50 bucks a month in premium, times that by 12, that's a lot more than $185. So do you see how you can number crunch? That's why you shop around. That's why you talk to companies and agents, because you want to number crunch. And we can help answer questions you might have along the way. We can help you with the number crunching. Our volunteers that I mentioned that are throughout the state can sit with you and help you number crunch, but eventually you're going to have to make that choice. We can't tell you specifically what plan to go with or what company to go with. We're just here to educate you. So that's a little bit about supplements. Another big thing about them is that they have no network. They are designed to work with federal Medicare, which is your red, white, and blue card. That is a federal program. Medicare is the same all over the country. So if you do original Medicare and then you also go out and buy a supplement, you have no network. You have the freedom to go to any provider, any hospital, any clinic that you want to go to. That would be important for people who travel. If you're a snowbird that leaves Ohio in the winter, if you have family or friends or children in other states that you want to go spend a few weeks with, you might want an option that's allowing you to move throughout the country and you're not confined to a network, okay? Because when I talk about Advantage plans, they do have networks. And do also remember that supplements pay after Medicare pays first, meaning if you do have a service done that Medicare denies, your supplement does not pay it either. They do not make coverage determinations. They take their cue from Medicare. Medicare has to pay first, and then they pick up what's left, generally speaking. One last thing. You see this bullet points talking about guaranteed issue. For those of you with the booklet, I would encourage you to flip back to page, I believe, page 10, because I want you to know where to locate it. There's a box at the bottom of page 10 talking about guaranteed issue. So generally speaking, supplements can deny you. They are not primary insurers. They are a secondary payer. They're not a requirement. They're more or less a luxury to have if you can afford them. So they do reserve the right to medically underwrite you. They do care how healthy you are. So they do make you fill out a health questionnaire, and based on that, they can either deny you coverage or charge you more, except if you are in a guaranteed issued period, okay? So this is why this is important, because everybody gets at least one time where they're protected, where they have that guaranteed issue, and that's when you first get on Part B. So whether you get right on Part B at 65 or you wait until you stop working and then you get your Part B, please know that for the first 6 months that you have Part B, you have a 6-month protection where you can go with any supplement from any company and they have to take you regardless of what may be going on with your health or regardless of your pre-existing conditions. For example, if I'm sitting down with a 64-year-old, and this happens a lot, and they have MS, or they have a chronic illness, or they've just been recently diagnosed with cancer, I really stress that to them, that if they ever want a supplement, this might be their best time ever to get one because they are protected. Because outside of that, a year down the road, 2 years down the road, 10 years down the road, now you're in your 70s and you're thinking, I want a supplement. I want them to pay my doctor bills. You're going to have to face underwriting. And you may not be healthy enough anymore to get approved for one. That's more of the gamble you take when you don't go into a supplement right in the beginning. So it really just depends on your health, and that's why we don't tell you what to do, because we don't know your health. You know it better than anyone. You know what might run in your family. You know different things like that. But everyone does get that one-time guaranteed issue. Outside of that, there might be some special circumstances where people would get another protection for 63 days. That is usually because you had insurance and you lost it, no fault of your own. A very common example are those folks where their company was giving them a plan as a retiree and then they canceled that benefit. Then they're protected. They might be 88 when that happens. That was my husband's grandmother. Her husband retired from PPG. Not that long ago, they decided to take away their plan. She's in her 70s. She was protected for 63 days and she went into a supplement and she didn't have to go through underwriting. That's a common example. But now we're going to move forward here and talk about Part D. So for those of you with the booklet, I would have you turn to page, you know what? You have 4 pages in your booklet on Part D. Go to page 18. Skip ahead to that page. I'm eventually going to get to a slide that looks like that page. But the booklet does have more pages on supplements in Part D than these slides are going to show. So that's the visual that we had from the very beginning. Remember that option 1 picture where you have Medicare supplement Part D? So here it is again. Now I'm talking about that third box, which is your drug coverage. Part D started in 2006. In order to give Medicare beneficiaries prescription drug insurance, it is a requirement that you have some type of prescription drug coverage when you're on Medicare. So I meet a lot of people who don't take prescriptions. So they wrestle with the idea of, why do I have to sign up for this and pay an extra premium for something I'm not going to use? But this is insurance, right? So you always have insurance for the what if. So in case you need it. So with Part D, there's over 20 plans in Ohio this year. And this is really where people want to contact OSHIP, or they want to meet with the local volunteer. Remember here in Lake County, the Council on Aging, there's several trained volunteers there. They'll actually help you look at Part D plans. Anyone can look at them on Medicare.gov. You put in your zip code, it will pull up all the plans that are approved for Ohio. You type in the prescriptions you take, the pharmacy you like to use, and it will show you all the plans and how they cover your meds at what cost. So the counseling that we provide is to try to identify the top 3 plans that are the lowest cost, that cover all your meds for the lowest cost. I've never had someone want me to show them the highest cost plan. They just want their meds to be covered for the lowest cost. So that's where we can step in and help you look at that. Because when you go to Medicare.gov, it can get a little confusing when you're comparing plans. What am I looking at? What does this mean? And we're here to help you understand that. So just know that there's really 2 ways that you satisfy the Part D requirement. You either join a Part D plan because you went the Medicare supplement route, or in a minute here I'm going to talk about Advantage plans. They include Part D in their plan. Okay? But Part D does give that prescription drug coverage, and every fall you can change your drug plan. You are not locked into the same drug plan for the rest of your life. Drug plans do not turn you down or deny you or underwrite you. Anybody can join them. So we get very busy in the fall because we do public events where people can meet with us for about 45 minutes and get that free counseling to help review their plan. So I do that all over the state. We get very busy in that time. In Cuyahoga County, I probably do over 10 events, usually at senior centers, where you can meet with me or a coworker or a volunteer, and we'll help you review. Kind of like tax season. We help people review. So that's a little bit about Part D. Another thing I do want to highlight, there is a low income program for folks to help pay for Part D. In your booklet, if you wanted to jump back just to know where it's at, it's on page 17 at the bottom. There's a box, but it's called LIS, Low Income Subsidy. It's also called Extra Help. We have brochures that talk about this. We want to screen people. We want people who are eligible to call us. You apply for Extra Help through Social Security. So Social Security started this program when Part D was started in 2006 to help those with a lower income afford prescriptions. So you do see big bold, it says no donut hole. Have you ever heard of the donut hole? Okay, I'm going to talk a little bit about that, but that's one of the biggest ways that Extra Help can save someone money is it removes this donut hole, okay? Now page 18, for my folks with the booklet, go back there because you will see this slide, more or less, on page 18. So people do commonly ask, well, what does Part D cost me? It really depends on the medicines you take. So this year, the lowest cost plan is about $14.50 a month for 2019. If you take 0 prescriptions, most often people will just join that lowest cost plan because you satisfy the requirement of having it. You do have drug insurance in case you do get prescribed a one-time antibiotic or whatever might happen. Like my husband had a sinus infection, so he had to go get an antibiotic. That would be an example of like a one-time thing that you might need your insurance for. Now, if you do take prescriptions, I wouldn't say just go with the lowest premium plan. I would say call OSHIP, let us do a plan comparison, even if you take just 1 prescription. Because we want to identify the correct plan for you, the lowest cost plan for you. But we would average the cost of Part D to be around $32, $33 a month in premium. Obviously, you do have co-pays when you go to the pharmacy, and that's another thing we would counsel you on. When you go to the pharmacy, this is your co-pay. Some of the plans do have deductibles, so that's what you have to pay first before they start paying 75%. Oftentimes, though, plans with deductibles, they don't enforce it for generics. So if you're on all generics, you don't have to meet the deductible. They just give it to you for a low cost. It's more of your specialty brands, your brand names, such as insulin or inhalers or special eye drops and creams, those types of things, you would have to meet a deductible first. But again, we would talk to you about all your out-of-pockets, how your plan works, and we would talk about the donut hole. For one more year, this year, the donut hole exists. So for some of you, you might totally escape the donut hole because you don't get on Medicare until after 2020. So it is gone in 2020. But for this year, folks can still fall into the hole. So when you fall into the hole, you literally have no more coverage. That's why it's called a gap. That's why it's called a hole. So you hit that hole at $38.20. When your total drug costs have totaled $38.20, $3,820, you're in the hole. So total drug cost is the key word. It's not your co-pays going towards that total. It's the actual retail cost of your medicine. You might have a $40 copay, but the retail cost is $500. So people hit that hole a lot quicker than they think. And that's why you don't just willy-nilly pick a plan based on the premium. You do a plan comparison because you want to be prepared and know if you're actually going to hit the hole. Some people don't. Usually if you're on generics, you won't. It's the brand names that can make people hit the hole quicker than they realize. But that's only for one more year because in 2020, it doesn't exist anymore. Okay? So things to consider is just that all plans are different. They have different formularies, which is a different drug list of the meds they cover. The cost structure can change. Copay amounts can change. Premium amounts can change from year to year. So that's why in that fall period of October 15th to December 7th, it is in your best interest to review your drug plan. You probably will leave your supplement alone, but your drug plan you easily can change from year to year. And we encourage you to if you want to save money, because plans can drastically change from one year to the next. They only sign one-year contracts with the government, so that's why we're encouraging people to review. It's the folks who come to me after 8 years of being on the same plan that I end up saving a lot of money, because they just didn't keep up with how the plan was changing, how the cost was rising. They didn't know that other plans had come around that were cheaper, things like that. So that's where OSHIP can step in and help you with that. There you go. Review every year. Look at convenience, coverage, cost. Convenience is pharmacy. Believe it or not, pharmacy makes a big difference in cost. So we can put in different pharmacies to see how that changes your copays. So sometimes people don't necessarily have to change the plan. If they just change their pharmacy, they can get a lower copay. Coverage is hugely important because I do meet people that are on the wrong plan and they don't even realize that the reason their medicine is so expensive is because your plan doesn't cover it. They just know they go to the pharmacy and they owe a lot of money. They didn't realize it's because it's not on the formulary anymore. And that's where we would explain all costs to you. How does the plan work? We're going to switch gears now. So those of you with the book, I want you to go to pages 21 and 22. 2021 actually. In the booklet, pages 20 and 21 are going to talk about Advantage plans. Remember this picture from the very beginning? Here it is again. It takes a lot of time to get through option 1. That's essentially what I just wrapped up. Medicare supplement drug plan. You have 3 different cards, 3 different premiums. It all works together to give you your coverage. But you don't have to go that route. You can do something called an Advantage plan. Has anyone ever heard that term, Medicare Advantage? I see a lot of commercials for them. When you're getting close to Medicare, you're going to get a lot of mail. You're going to get inundated with mail. It's marketing. A lot of that's probably going to be for an Advantage plan. It could also be for a supplement or a Part D plan. The biggest thing with your mail that you're getting is make sure you know what you're reading about, because people get really confused. Are you reading about a Part D plan, or are you reading about a supplement, or are you reading about an Advantage plan? So with Advantage plans, just know that they are an alternative. That's why we have that big or in between the options. So if you go the Advantage plan route, it's actually replacing Medicare. They came around in the 90s to give folks more choices and more options, but they are, we call them one-stop shops, because you're going to get your Part A, your Part B, and your Part D all bundled into one plan. And that one plan is going to be an HMO or a PPO. Have you guys heard those terms before? I have a PPO with my job. So oftentimes employer coverage is kind of like an HMO or a PPO plan. So when you hear those terms, that instantly is cluing you in, okay, you have a network you have to keep to. So there are over 30 different Advantage plans you could choose from in your area. Like Cuyahoga County has over 40. So many Advantage plan options you can look at. And they are going to be an HMO or a PPO. So with an HMO, you keep to the network or they don't pay. It's that simple. HMOs are health maintenance organizations, so don't join an HMO until you check out the network. Make sure your provider is in the network. Otherwise, you're going to have to change providers. And most people don't want to change their provider. Now with a PPO, they are preferred provider organizations, so they do prefer that you keep to a network, but they would still give coverage out of network, but you'll pay a higher rate. With Advantage plans, they do have out-of-pocket limits, so they do cap your out-of-pocket spending. That would definitely be a number you'd want to look at, because I have met people who have hit those limits. All it takes is a bad heart attack or a couple strokes or a lot of things, a cancer diagnosis where you need treatment, where you will hit that max. So the highest max that I've seen is $6,700 a year. The lowest I've seen is probably closer to $4,000, maybe $3,700, $3,800. So there's a range in the out-of-pocket limits. Advantage plans are sold by private companies. They're private insurance companies that have gone into contract with Medicare. So you are now subject to their network, to their rules, to their pricing, things like that. And they can also add in some extra things like vision, dental, hearing. It's usually pretty minimal, but it's still an extra. They might give you some money towards eyeglasses. They might give you money towards a hearing aid. They most likely will pay for a teeth cleaning. So it's not extensive vision and dental coverage, but it's still an extra. A lot of times they do silver sneakers. You ever heard of that? You get that free gym membership, and they can add in even some other extras. They're private companies. They can kind of customize their plan as they wish. So we just want people to look at the full package. But the biggest thing is look at the network. Do not just join an Advantage plan because it just sounded great on paper. Really check out the network. Ask your provider, what Advantage plans do you work with if you're wanting to go this route? Now, Advantage plans cost. There are some zero premium HMO plans. But remember, with an HMO, you are confined to their network. And usually their network or service area is specific to your county. So the plans sold in the northeast part of Ohio are not the same plans in Columbus. So I've met folks in even like southeast Ohio. I actually met a lady who got a really rare diagnosis that could only be treated at the Cleveland Clinic because it's a research hospital. And every time she was driving from Zanesville up to Cleveland, she was out of network. She didn't know that she was going to get diagnosed with that when she took her Advantage plan. But the sad thing is at that time, no supplement will take her because of the health. So she's kind of confined to the Advantage plan world. So that's why usually healthier individuals really like Advantage plans because they don't use the insurance as much. They get those extra perks. They get the silver sneakers. They get a lower premium. I would say the average cost would be around $50 a month for an Advantage plan. Some of them are $20, $30, $40. Some Advantage plans are over $100 in premium. There's a big range. But generally, with an Advantage plan, you have a lower premium, but you always have an out-of-pocket when you go. So you pay as you go. Does that make sense? So the more you go, the more you're going to pay up to the plan's spending limit. So that's why we're not going to tell you what to do, original Medicare supplement or an Advantage plan. We want to just tell you how they work. So the networks, the premiums, and the copays are going to vary by Advantage plans. So you want to shop around. And again, we're here to help you with that. Advantage plans are listed on Medicare.gov. Just like the drug plans are, so are Advantage plans. So you could put in your zip code and it would show you all the Advantage plans sold in your area. And you could click on them and look at the different benefits of them. What are their copays when you go to the doctor? What are their copays when you're at the hospital? Things like that. And we're here just to give you that general knowledge and counseling. Same with Advantage plans. During that fall open enrollment time, you can switch. Advantage plans do not underwrite, so they take anybody. So that's why you can easily switch them from year to year. I do want to go to page 22 to wrap up, and then I'll take questions. So those with the booklet, it's page 22. Just at a glance, it's basically highlighting how is a supplement different than an Advantage plan, because more or less that's what it's going to boil down to. Do you want Medicare with a supplement or do you want an Advantage plan? Because you can't have both. But people will often confuse supplements and Advantage plans. They think they're the same thing, but they're not. They're two totally different products, and you can't have both at the same time. You have to make a choice. So with supplements, remember that that says $134, but you are paying $135.50 this year for a supplement. So for Medicare, just to have your Part B. So with a supplement, you're paying your Part B premium, then you're also paying your supplement premium. And I quoted you a Plan F, which is like that Cadillac of the plans, at $150. If you did like a Plan G or a Plan N supplement, you might be looking more at like $100. Plan N, you might be around more $100. Plan G, maybe around $115, $120. Depends on the company you go with. So you have that additional higher cost premium for the supplement, but you're paying that high cost premium every month. It's a fixed cost. You're paying that so that you have very little or no out of pocket when you actually use services. So you're paying up front. Instead of paying as you go, you're just paying up front in the form of a premium so that if you get sick, if something happens, they're going to pick up your cost. But it's the folks who are healthy that kind of wrestle with that. Why am I paying this every month when I never go? But again, it's insurance. It's what if you get sick kind of deal. And remember, with supplements, you only have that one-time protection. The first 6 months you're on Part B, where they can't turn you down. And supplements will raise your premium as you age. It's called attained age, so as you get older, your premium goes up. That's why you do talk to the company about how do you raise premiums? How much do you raise them? How do you do it? How often? Things like that. But with supplements, you have no network, so you can go to any provider that takes Medicare. You can travel throughout the country with it. It travels with you. So things to consider is just that, like I said, if you're more of a frequent traveler, you might do better with Medicare and a supplement. If it's very important to you that you are able to choose the provider or the hospital that you want to see, you might want this route because there's no network. You can go wherever you want to go. But you also have to be realistic and say, can I afford those higher premiums? So your pocketbook does come into play there. And you also always have to purchase that separate drug plan. That's why there's those 3 boxes. Now with an Advantage plan that I just talked about, you are still paying your Part B premium to the government. You don't walk away from that. So they're still going to take that $135.50 out of your Social Security check. Now with Advantage plan, you could have anything from a 0 premium to over $100 in premium. There's a great range in their cost. But generally you're going to pay a lower premium, but then you're always charged a copay when you use services. So the more services you use, the more copays you'll pay, up to the plan limit. Remember, they have those spending limits. So sometimes it's people who have to see multiple specialists and they have a $50 copay every time they see a specialist that can sometimes want to get out of the supplement because they don't want to have to pay that copay every time they see their specialist, things like that. But the biggest thing is to make sure that you pick a plan that your provider takes. Providers are allowed to choose the insurances they want to take. So you always want to double check with them because your cost is higher if you are out of network. So always check too with the plan for travel restrictions. They might have a network in Florida. Ohio plans have caught on that a lot of Ohioans go to Florida. So they might actually have someone in Florida you can go see. But that's where you want to check with the plan, things like that. But generally speaking, an Advantage plan would be better for someone who doesn't travel as much because your service area is your county. So if you're pretty much keeping to your county, this is where your family is, this is where you are, you might do very well with an Advantage plan. You have to be willing to use a network. If that just sounds horrible to you, then you probably won't like an Advantage plan. And a lot of people will join them if they are healthier and they have few provider visits because they are going to save money. They have that lower premium. And they do have those added benefits of some vision, dental, and hearing that people like, those extra little perks. So a lot of things to consider. Usually, or all the time, your Advantage plan does have a drug component. Your prescriptions are covered by the plan, so that's where your Part D comes into play. So with an Advantage plan, you do just have one card. It's an HMO or a PPO. You have one card. It gives you all your coverage, hospital, outpatient coverage, your doctor services, and your drug benefit. So that is the options in a nutshell. Okay? So I do appreciate your time. For those of you with the booklet, you do have something in the back that has our phone number. Please call us with questions. We want to help be your accurate source of information. We can locate you to your closest volunteer in your county that if you want to meet face-to-face with someone. But I will open up for those of you that have questions and have been so patient this whole time. Yes, sir.
Thanks for taking these questions real fast then. If I can't collect Social Security, I just have to apply on my own.
Correct. You have to go to Social Security and apply, or go online to Social Security's website. You can do it online.
And they go back to 80-20. You were mentioning about the 80%, 20% pay.
So, okay.
I review that if you could.
So when you have original Medicare with Part B, once you've met your deductible of $185, then Medicare starts paying 80% of the cost.
And if the cost, let's say, is $1,000, I'm paying $200.
Yes, assuming that.
Along with the deductible.
Correct. Well, thank you everyone for coming and spending a little bit over an hour with me. If you have questions, please call our number. We are actually a 1-800 number where you actually get a live human right when you call. So thank you.
Well done.